Good morning, everybody. Ladies and gentlemen, indeed it gives me great pleasure to be part of this very important meeting as we deliberate on a matter of great national importance, and that is maternal, newborn, child, and adolescent health in our country. Indeed, I think we will all recognize that childbirth should be a joyous moment for families and communities. And mothers are the gateway to family and child health. As we all know, the wealth of a nation is very closely associated with its health. It is therefore a matter of great concern to my government that in this country, as many as 21 women die every day while giving birth. Simple interventions that can effectively address barriers for accessing essential care for pregnant women, such as user fees, distance to service delivery points, and lack of qualified birth attendants, are all within our reach, and all that they require is our priority attention. Most maternal deaths are avoidable and indeed preventable. My government has a very clear vision on healthcare for all Kenyans. In an effort to reduce maternal deaths, my government is also providing free maternity services, which, as James has just mentioned, has led to an increase in the number of women giving birth at health facilities from 450,000 a year to over 700,000. In this connection, I want to commend all our dedicated healthcare personnel who work under very difficult circumstances to save the lives of women and babies in our country. To complement the impact of my government's health sector reforms in the areas of maternal and newborn health, the First Lady has also launched the Beyond Zero campaign, which also seeks to reduce child and maternal deaths by launching mobile clinics in every county. Fellow Kenyans, our Constitution, the Constitution of Kenya 2010, has given us the opportunity to tailor interventions according to the specific needs of the different communities by devolving health services and bringing them closer to the people. I would like to thank our governors and indeed our county governments for the excellent work that they continue to do to improve health services. My government recognizes that the current health infrastructure in our country is inadequate. And as a consequence, we have embarked on aggressive initiatives to ensure better health infrastructure across the country. We are currently in the process of equipping 2 health facilities in every county with state-of-the-art medical equipment to ensure specialized health care is brought closer to our citizens while decongesting the 2 national referral hospitals. I am pleased to see several development partners actively also supporting the health sector, partners such as the United States, the United Kingdom, the Danish government, the Japanese government, the German governments, multilateral agencies such as the Global Fund, Gavi, and the World Bank Group, and UN agencies, supporting the sector with new commitments of over $2 billion during the next 4 years. In the last few months alone, the Ministry of Health, supported by the World Bank Group and the United Nations Population Fund, have mobilized over $70 million to advance maternal and child health, a clear recognition by the international community of Kenya's commitment to every woman and every child. As we seize these new opportunities, let us also harmonize such efforts with the national policies and commitments for universal health coverage in the devolved health system to avoid unnecessary duplication. Ladies and gentlemen, I wish to commend the 15 governors who met in August of last year, and these are the governors with the highest burden of maternal deaths, who came together to ensure that no woman dies giving life. I congratulate the governors of Garissa, Homa Bay, Isiolo, Kakamega, Kisumu, Lamu, Mandera, Marsabit, Migori, Nairobi, Nakuru, Siaya, Taita Taveta, Turkana, and Wajir for being courageous and sensitive to the needs of mothers. Partnerships between practitioners in health and faith-based organizations have existed throughout our history. Indeed, in Kenya, about 40% of the health facilities are managed by private, not-for-profit organizations, which are largely faith-based. The role of religious leaders in maternal and newborn health provision can therefore not be ignored or underestimated. Religious leaders are at the core of the community and play an important role in shaping its opinions, values, and practices. Our clergy have well-established networks, capacity to reach rural and hard-to-reach populations, and they are respected and trusted by local communities. Faith-based organizations have also helped to bridge the gap in healthcare through provision of primary healthcare services to the people. Apart from maternal health services, they also provide immunization, emergency relief services, and training of healthcare workers. In view of this important role that religious organizations play in the community, over and above their spiritual nourishment role, I reiterate the call to action to end preventable maternal deaths in Kenya and invite our religious leaders to rededicate their efforts to this noble cause. In doing so, we shall not only safeguard the future of our mothers and our children, but we shall also safeguard the future of our great nation. Ladies and gentlemen, I know that together we can do this, and I just want to state that I am here to give my own commitment, my government's commitment to this particular endeavor. I am convinced that this is a problem that we can resolve if we were to work together. It is not difficult to resolve it. The few interventions that we have managed to do in just 2 years prove this to me. So by extension, if each one of us could really just be committed and be committed at the place where they operate, we can resolve this problem and bring an end to unnecessary death of our women and children. It is possible. We are committed to give the resources. James will tell you here, I put him under consistent pressure every day. And I'm certain if these governors sitting here were to do the same with their own officers, hii kitu within a year tutamaliza. I'm sure it's possible because the resources are there, the commitment is there. Yeah? We just need to follow it up ourselves. 2 weeks ago, we were at another function, and some of the statistics that we were given also were quite alarming in terms of the number of our adolescent children who, because of have HIV transmitted through mothers, and a good number of them not on antiretrovirals. I have instructed our county commissioners in every county to establish, in conjunction with the Ministry of Health, how many of our mothers and adolescents are affected so that we can put them on antiretrovirals and give them the necessary treatment that they require. I want to ask my fellow leaders and my governors here, our governors who are here, our religious leaders, help us in this process. By so doing, we educate and we can stem the issue of our children being born with HIV. And it's just a question of care. Let us just identify who they are. Let us treat them as normal human beings, which they are, and let us give them the care that they require. And I'm certain that we would be able to reduce mother-to-child infection almost to zero. But again, a government alone, county governments alone, cannot do it without the support of people like you here. So mine really is to request you, ladies and gentlemen, to please support us in this endeavor, and I'm sure that the success that we shall see shall be the health and prosperity of our country, and truly that we will be able to achieve a situation where truly giving birth becomes a joyous occasion for our families and our communities. With these very few remarks, ladies and gentlemen, I now declare the consultative meeting of ending preventable health, maternal and newborn deaths officially open, and I wish you God's blessings as you deliberate. Thank you very much.